You've been doing a lot of media. Why do you think people are reaching to Youngstown and to you for comments, for instance, ABC News and some of the other networks?
Yeah, I think we saw the biggest spike in the beginning. That was part of it. In the beginning, we saw the biggest spike in March and April before anywhere else in Ohio. So that put a lot of attention on us now. I don't know. I think we just have we have a lot of great local news that do a lot of stories on this. My 14-year-old makes fun of me all the time. He says, every time you talk, you say the same thing about COVID. He goes, I can tell you what you're going to say. And that's true, because I say the same thing every time. I just wish I could continue to get the message out.
Sure.
And I know it's hard, and I know people are concerned that they're losing out on short term, which we absolutely are. Things are so different. I feel bad for kids who are they don't have the normal school life. My son's in high school, my other 3 children are in grade school, and they're missing out on a lot of the activities and the social events, and personally, all the gatherings of friends and parties we've missed out on. Fortunately, in the summer we had a little bit of that outside, but now we're missing out on it, and I think that it's unfortunate and terrible.
Yeah.
But I see the beginning of the light coming, which is the vaccine, and the more vaccines we can get, it will help for Christmas of 2021 and Thanksgiving of 2021 to be more normal.
What do you see, I guess, as top priorities for chief clinical officers like yourself moving forward?
Right now, I'm spending a ton of my time on COVID and working through protocols and working through the vaccine planning and infusion centers for the new monoclonal antibodies. We're doing a lot of issues like that. But putting COVID aside, although it's very, very important, putting COVID aside, one of the things I spend a lot of my time on is really working on our network. And network is a grouping of physicians and providers that take care of patients with a focus on quality and cost of care. And that's the new focus as we go into 2021 and beyond, as far as how the government and private payers pay hospitals and physicians. It's not so much on quantity of care anymore, it's on the quality of care and cost of care. And so that's something I spend a lot of my time on. The other part I still spend time on is the old-fashioned hospital qualities, looking at metrics for Clostridium difficile in the hospital, mortality of sepsis, infection with severe illness, readmission rate in the hospital, length of stay, the time of patients are in the hospital. Those are the areas I focus on as well. So those are my biggest areas. I also focus on a lot of the working with the strategy team and the finance team here at Mercy Health Youngstown, working through areas of where we can serve our patients. Mm-hmm. Hospital systems, Mercy Health Youngstown, for example, used to be 3 hospitals. It was 2 hospitals, St. Joseph and St. Elizabeth Youngstown. We added St. Elizabeth Boardman 13 years ago now. But we also have 25 plus physician practice sites. We employ 350 physicians and nurse practitioners and PAs in our group. I started in the role 7 years ago, and then that number was 70. Now it's 350. So we have a lot more than just three hospital buildings. There's those type of areas that we need to focus on as well, all of our physician practice sites. And the last thing I really focus a lot of my time on is education. And we train about 150 resident physicians here in Mercy Health Youngstown, in 9 or 10 different specialties that we have, and we're growing those to even more. We're hoping to do hospice and palliative care training moving forward as well. So that's the future. That's one of the most exciting parts of my job, is working with the trainees who are resident physicians and medical students, and then hiring them over to work with us in the future to care for more patients.
What is your message to those interns on that first day? Are there certain really points that you try to get across to them? And I guess once they are working in the hospital, what do you find that they find most surprising, I guess?
So I think my message is really, you're part of the team and you're always on. I always say this to them in the orientation. I meet them on July 1st when they start, and I say you're always on. And what I mean by that is, as a physician and really a healthcare worker, you don't turn that off when you leave the hospital. You're always there. So your behavior outside of work, your behavior on social media, your behavior in the mall or the grocery store is you're that physician, because those patients will always see you as that. So I always do tell them that on day one. I also, what they're surprised about really is the volume of patients we have in Youngstown with the wonderful mix of illness. It may sound terrible to say the wonderful mix of illness, but this is a great place to train. They see everything here. They see very simple patients who are admitted in the hospital. They see simple patients in the outpatient setting. They see very, very sick and complicated patients that we are blessed to be able to keep in Youngstown. We send very, very few patients to Cleveland or Pittsburgh. We treat the vast majority of the patients that come through our doors, and the residents are surprised, I think, at the nice educational opportunities they get in our patients who are here, and we do a great job taking care of the patients.
Ideally, what do you think needs to be done to bring healthcare costs under control and make medicines and medical procedures, I guess, more affordable to everyone?
I think what we're doing now with electronic medical records has really helped reduce waste. For example, Mercer uses the Epic system. Epic is the biggest electronic health record in the country. And as more and more health systems use that one system, for example, use Epic, Cleveland Clinic, UPMC, Ohio State, SUMA, and Akron, we share information very, very easily. One click of the button, very easy. So, for example, you have a echocardiogram of your heart in Youngstown, and you see a heart doctor in Cleveland or in Akron as well. In the old days, they would say, we're going to repeat that test. Now, with one click of the button, they can see that test again. It's less duplication, reduces cost. Even health systems that don't use that same electronic medical record have a lot easier sharing. It could get better. It should get better. And so I think as that continues to evolve, one record for everyone, that you don't have to repeat the tests, I think that will save costs for sure. I think having the ability for patients to receive outpatient care rather than emergency room care is important. I've spent a lot of my time working with, again, setting up flu clinics for COVID, but also setting up walk-in care, is working with the team in primary care that we have. We have 5 walk-in sites from Salem, Columbiana, North Lima, Youngstown, Liberty, Howland. That's 6 even, to be honest.
Urgent care.
Not even urgent care, but walk-in care.
Okay.
So walk-in care is where you can go into a primary care office, and it's a lower cost. Urgent care's
Than an ER, obviously.
There's almost 3 different levels of cost. ER is the highest cost, urgent care is the middle level, and primary care walk-in care is the lowest level of cost. And setting up those sites where primary cares can walk in, you can see you walk into a primary care office and just be seen at the lowest cost by the right person. So I guess my message is, seen by the right person at the right level of care will reduce costs for the system overall.
Thanks for watching the video. Be sure to like, subscribe, and hit that little bell for notifications. And also make sure to connect with us on Twitter, Facebook, and LinkedIn. For all of your business news, visit businessjournaldaily.com. For all of your arts and entertainment news, go to afterhoursyoungstown.com.
Built for the 21st century American workforce, Eastern Gateway Community College has 2 campuses and is a national leader in online learning. EGCC.edu is a digital gateway where 30,000 students are quickly transforming their financial futures through degrees, certificates, transferable credits, and higher-paying jobs. And now, residents of the Mahoning Valley can enroll in summer classes for free. It's the EGCC Summer Guarantee. Eastern Gateway. America's new workforce starts here.